But I will explain to you the current benefit package that we have for cancer care. So under cancer care, Kenyans are eligible to 550,000 Kenya shillings. That's a little bit over 500,000 Kenya shillings. And this package covers for all types of cancer. Now, the journey of a cancer patient is particular in a manner where step one is to plan out the management of this patient. And step one involves diagnosis. We need to find out what kind of cancer do you have and what stage of cancer do you have. And to do that, SHA actually has and reimburses the tests required, the biopsies required to determine the diagnosis of the patient. Once we have the diagnosis of the patient, we then define the management plan. And the management plan can be surgical or medical, or both. If it is a surgical plan, then surgery is actually catered for on SHA rates that are available in the tariff, depending on what part of the body would be excised, where the tumor would be taken out. Now, if this patient is determined to require both medical and surgical care will be covered by SHA, and we have those examples of patients who've received surgical care. Two, medical care will now involve chemotherapy cycles at that cap limit of 550K. And so erroneously so, the patient who came to your offices still has a balance in his cover, and he has not exhausted his cover. And we're willing to help him. He just needs to dial 147, and we'll attend to his case and educate him on the cover and the availability of his cover. Now, once that is complete and a patient has exhausted all the cycles that they require, they then are upgraded to the ECCI fund, where we have an additional cover of 150K Kenya shillings. And so the cancer package under SHA is actually better and more comprehensive compared to that was in NHIF.